Low-level light therapy, also known as photobiomodulation, is definitely a mouthful. But the question is, does it really work? And the answer is kind of. Let me explain. There have been studies done on this, and there have been indications for it across the board, from muscle aches and pains, skin rejuvenation, acne treatments, wound healing, hair restoration, dental applications. But the studies have shown that as a solo treatment, it's not super effective. However, when you combine it with something else, it helps boost the results of the treatments that you are doing. So, how does low level light therapy work? Well, without getting too technical, you utilize a red light, usually between 600 and 700 nanometers, or near infrared light between 700 and 1100 nanometers. And what it does is it penetrates into the cell, and then the cell utilizes an enzyme that converts this light into energy in the mitochondria. That energy, in the form of ATP or energy molecule, then converts it and utilizes it for a series of cellular biochemical reactions that allow for production of growth factors that then allow for tissue repair, collagen synthesis, neurogenesis, decrease in inflammation and pain, et cetera, et cetera, et cetera, all the good stuff. So, for instance, in hair restoration, low-level light therapy can be utilized effectively in combination with something like minoxidil or PRP treatment or oral finasteride. In fact, low-level light therapy is one of 3 FDA-approved treatments for hair restoration, which is kind of a big deal. What it does is it improves hair thickness and density, especially in people who have male or female pattern hair loss. It improves and lengthens the anagen phase of the hair follicle. That's the growth phase of the hair follicle, which then decreases the time of hair loss. And it also increases blood circulation to the hair follicles, nourishing them and keeping them healthy and vitalized. When you utilize it with the other treatments that we mentioned, it's been shown to really improve the look, feel, and duration of your hair. So it's definitely a beneficial treatment for those who are suffering from hair loss. In skin rejuvenation, it's utilized for a multitude of things, everything from anti-aging to acne treatments. If you're utilizing it for acne treatment, you want to utilize a device that not only has red light but also blue light. The reason for the blue light is that the blue light will help fight the bacteria that causes the acne, while the red light will deal with the inflammation and the wound healing. In pain, it has been FDA approved for temporary relief of pain. So if you have a tendon tear or ligament, it's not going to fix it. But if you have the occasional aches and pains in your lower back, in your neck, etc., it is definitely a tool that you can utilize to help. It works best when combined with physical therapy to get the best results. Now, this is a device that you can utilize in your doctor's office, in a physical therapist's office, or at a med spa. But it is also consumer friendly, meaning you can purchase a device and keep it in your home. These devices can run anywhere from a couple $100 to a couple $1,000, and it really depends on who makes the device, whether or not they have clinical evidence that their particular device works and is reliable. Okay, those are kind of things that you want to look at. And it also depends on how many different protocols they have for their particular device. Meaning, if you're utilizing the device for hair restoration, the protocol is different than for anti-aging, which would be a different protocol than for pain, etc. So, is it worth it? Well, if you're getting it done at home and you're utilizing other treatments in combination with it, yeah, it can be worth it for sure. If you're utilizing it as a standalone treatment, hoping it'll fix all your problems, no, it's not going to help you. But a key note that I do want to say before we go is if you are using it for any medical indication outside of aesthetics or hair restoration, certain things can actually be covered by insurance. So definitely speak to your medical provider about that. So think about it and let me know. Do you think that it is effective in your experience? Have you given it a try? Drop a comment and let's talk about it. Let's keep learning together.